Welcome to the Fred Douglas Manor. It's great to see everyone turn out. It's obviously a very important day here in Winnipeg, Manitoba, and indeed across Canada. With me, I have two distinguished individuals, the Federal Minister of Health, Minister Duclos, and our Provincial Minister of Health, Minister Gordon. And it's always so encouraging when governments recognize the need to come together to work on what are priority issues for Canadians from coast to coast. In particular here in the area of Winnipeg North, and I want to welcome both ministers to the area that I represent with a great sense of pride and humility. During the pandemic, the Prime Minister often talked about the importance of recognizing how it is that we can build back better. What can we learn from the past? And one of the things that I believe is universally understood and believed is the issue of home care, long-term care support, and how it is that we need to look at that. And just last year, Minister Duclos was assigned the task going out of the federal election in dealing with the issue of long-term care. And it's such with pleasure in my mind that we have such a distinguished individual, a tenured professor prior to being elected to the House of Commons back in 2015. I like to consider Minister Duclos as a good friend, someone that really has a caring attitude and wants to make a difference in Canada in dealing specifically with some of those issues that we talked a great deal about in the last national election. So without further ado, if I could ask Minister Duclos to take the mic and make the announcement for this morning. Minister?
Well, let me start by saying good morning, everyone, et bonjour tout le monde. Let me speak very briefly about Kevin. Kevin reminded me of something that I have almost forgotten, which I used to be an academic. What he didn't say is that since then, since 2015, one of my great privileges has been to get to know and appreciate Kevin. We have in this community a member of parliament which makes a significant presence in the government of Canada. And when we hear Kevin, not only do we hear about the government of Canada, but we always hear about his community. So let's be mindful, and I'm certainly very appreciative of Kevin's role in working and fighting for this community and all of your constituents, Kevin. Now, it's also a pleasure, obviously, to be here at the Fred Douglas Lodge in Winnipeg, and thank you, Roslyn and all the team for welcoming us. I would also like to acknowledge that we are speaking to you today from Treaty 1 territory, which is the traditional territory of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dean peoples, and the homeland of the Métis people, the Métis Nation. Je tiens également à remercier le Fred Douglas Lodge pour le travail remarquable qu'on accomplit ici à tous les jours. Nous savons tous que le Lodge fournit des soins et un soutien indispensable aux habitants de cette communauté, en particulier, évidemment, pour les personnes âgées et leurs familles. So it's a privilege to be here today, along with the Honourable Audrey Gordon, Provincial Minister of Health. Audrey, it's the first time we meet in person. You noted that earlier. It's not the first time that we see each other. We've been working, obviously, virtually for many, many months now since you've been appointed as Health Minister. I want to thank you on my behalf, but more importantly on behalf of the Government of Canada, for your leadership and partnership in demonstrating what Kevin said, how we can achieve the right outcomes for the people that deserve those results in our community. This, obviously, much of what we do is behind the scene. Not everyone has the ability, as I have, to see your dedication and your work, and I wanted to be publicly mentioning it. Now, we are here to announce an agreement that will significantly improve the lives of everyone who lives or works in a long-term care home in Manitoba. And this agreement could not come at a better time. And that's because over the last 2 years, the pandemic has highlighted long-standing issues in our long-term care system, such as gaps in infection control, including against COVID-19, but against other infectious diseases as well, staffing, infrastructure, the overall quality of care with the tragic effects on residents that we have seen, their families, and all those working for them and caring for them. No one will ever forget the suffering endured in long-term care homes across Canada during the COVID-19 pandemic. And knowing what we now know, we can't look away. We need to do everything we can to protect our seniors and everyone else who lives and works in long-term care. Together with provinces and territories, we can do better and we must do better. Nous sommes déterminés à travailler avec les provinces et les territoires tout en respectant évidemment leurs compétences en matière de gestion des soins de santé pour relever les défis qui ont été si évidents pendant la pandémie pour celles et ceux qui vivent dans des établissements de soins de longue durée. And that is why our government created the Safe Long-Term Care Fund. This $1 billion fund is being used right now to help provinces and territories improve the safety, the quality of care in long-term care. In Budget 2021, we also invested $3 billion over 5 years, starting this year, to support provinces and territories in their efforts to ensure that standards and achievements for long-term care are applied and permanent changes can be made and sustained. This additional funding will be available to help provinces and territories strengthen compliance and enforcement activities, support workforce stability, including through wage top-ups and improvements to workplace conditions, for instance, staff-to-patient ratios and hours of work. And so today, I'm pleased and proud to announce that our governments have signed an agreement that will improve the health and safety of long-term care homes, patients and workers in this province. Grâce à cette entente, le Manitoba recevra plus de 37 millions de dollars pour la prévention et le contrôle des infections, les ressources humaines et l'amélioration des infrastructures. The province has developed an action plan setting out exactly how this $35 million support from the federal government will be used, which includes financial support for staff retention, ensuring adequate supply of personal protective equipment for staff and visitors, renovation and upgrades of ventilation systems within facilities, and strengthening infection prevention and control measures, as well as training. Our governments are committed to working collaboratively to drive positive healthcare outcomes for all Canadians. And that's also why, in March 2022, the Government of Canada announced an additional investment of $2 billion to help our provincial and territorial partners significantly reduce the backlogs of surgeries, treatments, and diagnostics that were created because of COVID-19. This additional investment is part of a broader list of priority areas in healthcare, which are 5 types. A, reduce backlogs and support healthcare workers. B, enhance access to family health services and primary care. C, improve mental health and substance use services. D, help Canadians age with dignity closer to home. And E, use health data, the power of health data and virtual care more effectively and more equitably. Finally, as you know, our governments have also been working hard over the last 2 years to protect Canadians against COVID-19, including by purchasing and distributing vaccines free to provinces and territories, as well as to several other institutions and organizations. And that's because vaccination is one of the most important ways that seniors everywhere, including here in Winnipeg and Manitoba, can protect themselves and their loved ones against COVID-19. Si la vaccination est essentielle, il est désormais clair que 2 doses ne sont plus suffisantes car l'immunité s'affaiblit avec le temps. And because of this waning immunity, if I may open a brief parenthesis, waning immunity is like your phone cell. Your battery discharges over time. It eventually becomes dead. The same thing for vaccine protection. That protection falls over time. So like a battery, we need to recharge our protection, and that comes with a booster dose in being up to date in terms of vaccination. So let me therefore take this opportunity to remind everyone of the importance of following the recommendations of public health authorities and staying up to date with our vaccination, which means roughly getting a booster shot 6 to 9 months after the earlier shot. In other words, if we're eligible for a new shot, we should get it as soon as possible. That is the best way to reduce transmission, to reduce the risk of severe illness, hospitalization, deaths, long COVID. It's also the best way to protect our healthcare workers, which in this province, as in all provinces and territories across Canada, are feeling very heavily the burden of the last 2 years and a half. They need our help. They need our support. They need our care for them to be able to care for so many others. Every senior, therefore, deserves to live in dignity in a healthy and comfortable environment, and the people who care for them also deserve that safe workplace in which to do their jobs. Good news that today's agreement finalizes all agreements with all provinces and territories. And this agreement we are announcing today puts money, thanks to the leadership and partnership of the province, where it is needed most, and will improve the day-to-day lives of some of our most vulnerable citizens. Je tiens donc, en terminant, à remercier la province du Manitoba, la ministre de la Santé du Manitoba, pour leur travail continu visant à garantir que les établissements de soins de santé, de soins de longue durée soient sûrs, sains et confortables pour les résidents et le personnel. And talking of partnership, let me now turn to Minister Audrey Gordon, the Minister of Health. Thank you.
Good morning. Hello, everyone. Bonjour. Welcome, Minister Duclos, to Manitoba. I think this is your first visit here, and it's a pleasure to have you. I hope you'll enjoy your time with us. I know you won't be here for long, but Manitoba has a lot to see and do, and I hope you have an opportunity to take in some of that. I'm happy to be here joining my federal counterpart, Minister Duclos, on this announcement. We know that through the pandemic, those living in long-term care faced significant challenges. The funding announced today by Minister Duclos is a welcome addition to the efforts already in place from the Manitoba government. Earlier this year, our government announced the establishment of the new Seniors in Long-Term Care, and my colleague, Minister Johnston, to address seniors' issues across the province. Further supports are being made through our government in terms of enhancing infection prevention and control within the long-term care sector, which includes a provincial program manager, regional leads, and infection control staff. Also, improvements to information and communication technology to better support operations and patient care, and we're adding more housekeeping staff, among others. Our government is committed to supporting and protecting the people who continue to be most at risk from COVID-19 while we work to restore our healthcare system. This includes ongoing investments at personal care homes, as well as additional funding to our health authorities to help address the increased costs of providing care caused by the COVID-19 response. Manitoba is also investing $110 million in provincial funding to address the wait lists across the healthcare system caused by the pandemic. Thank you again for joining us. Merci and miigwech.
Good afternoon. Welcome to the Honourable Jean-Yves Duclos, Honourable Audrey Gordon, and Mr. Kevin Lamoureux, and to everyone who's joining us today. Thank you for visiting Fred Douglas Lodge to make this important and most welcome funding announcement. My name is Roslyn Garofalo, and I'm the Chief Executive Officer of Fred Douglas Society. Fred Douglas is a nonprofit, faith-based organization that has been serving seniors in Winnipeg for almost 60 years. We are joined today by some of our employees and board members as you make this significant announcement. In recent years, long-term care in Canada has been under an intense spotlight. The COVID-19 pandemic has highlighted the importance of long-term facility operators and all levels of government working together to solve complex and immediate problems and crises. Today's announcement makes clear the federal government's commitment to the seniors in our province and throughout our country who have built and shaped our communities and who now rely on others to care for them. During the pandemic, long-term care facilities, including Fred Douglas, responded, adapted, and enhanced safety measures such as infection control and staffing. When received, the funds announced today will be used to continue infection control measures put in place, will be used to enhance infrastructure within the long-term care sector, and most importantly, to enhance and support our staff to ensure the care the residents deserve is provided. Residents deserve to live in a safe home where not only are their physical needs met, but where we strive to ensure the whole resident is cared for, providing them with stimulating recreational activities, spiritual support, and visits with friends and families. Sadly, much of this was restricted or greatly reduced over the past 2 years. While the pandemic has eased, it is still very much a threat to our seniors and the general public, and we're working to ensure our compassionate and loving care of the whole person is maintained. Our employees have shown their incredible dedication and have responded with resiliency during these past 2.5 years. Their lives have been filled with uncertainty and ever-changing direction as we all learned more about the COVID virus and responded. I want to thank you, our employees, for your willingness to adapt and to provide the best care you could and continue to provide to our residents. It has been inspiring to witness. Now, as we face ongoing and new challenges, including burnout, staffing shortages, ever tighter budgets, and COVID fatigue among our employees, residents, and families, we will work to find creative solutions to support one another. Our resident families have been immensely supportive to our employees during this time, while they are also doing their best to support their loved ones who are living in our care. Long-term care is a critical component of the public health system in Canada, and it needs and deserves that recognition and to be prioritized as such. Fred Douglas would welcome the opportunity to work with government to explore and develop innovative care models and designs, providing a range of service options to meet the needs of seniors. My long-term care colleagues and I are encouraged to see more discussion about its importance within the continuum of care and the commitment from all levels of government to address long-standing issues. Seniors across Manitoba and across Canada deserve the best care we can provide, and the more we can come together as partners in our efforts, the more we can achieve and provide the services that are deserved. Thank you. And over to Juliette.
Merci beaucoup. Bonjour à tous. Nous allons maintenant passer à la période de questions. We will now proceed with the question period, starting with questions from those in person. Please indicate your name and media before asking a question and limit yourself to one question and one follow-up. Si vous veuillez indiquer votre nom et votre média avant de poser la question et vous limitez à une question et une question de suivi.
Mr. Duclos, s'il vous plaît. Yes, hi, Bartley Kivas at CBC here. Yeah, please, to the mic, thanks so much. Quebec's public health director yesterday said that province will stop using existing vaccine supplies when the Moderna bivalent product arrives. What's Canada going to do with all the shots it has?
Well, first, you are pointing to vaccination, which again is key in keeping the fight against COVID-19. When we speak about living with COVID-19, it also means keeping the fight against COVID-19. Every week, 400 people die still in the middle of the summer because of COVID-19. It still is obviously a big impact on people's lives, but also on the healthcare workers' lives, as I mentioned earlier, who are very burdened and tired with the heavy load that they've suffered and borne over the last few months. And when it comes to vaccination, the good news is that Canada, since the very start, has been a world leader, thanks to the collaboration of provinces and territories, in getting vaccines into people's arms. We've been very, very good, and we can be proud of that. And that has saved probably tens and tens and tens of thousands of lives and probably millions of hospitalizations. Huge healthcare costs have been avoided because of purchasing and administering vaccines. Now, we're probably quite soon, we'll be able to hear from Health Canada on the next formulation, which is going to be a significantly better formulation, which will protect against the old virus and the new virus, which has made so much damage over the last 9 or 10 months. Just to give you an example, in the first 6 months of 2022, we have had more hospitalizations and more deaths than in an entire year of 2021. So that says that COVID-19 needs to be fought against, and that formulation is going to be key. We're managing, obviously, vaccination supply in collaboration and support to provinces and territories. We have full confidence they are using the vaccines to the best effective and equitable manner, and we'll continue that collaboration.
You didn't hear my question. I actually asked you what you're going to do with the existing supply that isn't the bivalent vaccine. Now, the Quebec says they're not going to use it anymore. What will you do with all those doses?
It's up to provinces and territories to manage both the existing supply and the possibly forthcoming supply. They'll be, as they have always been, they'll be transparent, including in Quebec, as they've done just recently. Manitoba will also do that on its own terms.
And is it still going to be 2 weeks from now that the approval comes?
It will come quite quickly. I obviously don't control that agenda because it's based on science and independence. We want people's confidence in vaccines and other treatments to be as strong as possible. That it requires the decision and the time of the decision to be decided by Health Canada.
And you spoke about the importance of booster shots for healthcare workers. How do you feel about the fact that here in Manitoba, people under 50 still can't get a second booster?
Again, we have a big federation. Provinces and territories work in different conditions with different constraints and different objectives. So it's up for them to identify the speed and the type of vaccination agenda that they will want to conduct.
Merci. Prochaine question de la salle.
Bonjour, Monsieur Duclos, Chantal Louis, Radio-Canada, au Manitoba. Donc, vous avez parlé à ce moment qu'il y a beaucoup de... la pandémie a exacerbé justement les soins de longue durée. On a vu les conséquences là-dessus. Qu'est-ce que vous avez appris? Vous avez décidé de mettre $1 milliard l'an dernier, 35 millions au Manitoba. Qu'est-ce que vous avez appris pour vous permettre de prendre cette décision?
Bien, on entend, comme la ministre Gordon le fait aussi à tous les jours, on entend à quel point la pandémie a eu des effets cruels sur les gens, les résidents, les patients, mais aussi sur les travailleurs dans le domaine de la santé. Les infirmières en particulier, elles sont 400 000 au Canada. Elles sont là pour des raisons de passion et de compassion. Ce qu'on entend d'elles, c'est que depuis plusieurs mois, et malheureusement ça s'aggrave encore, elles ont de la difficulté à donner les soins qu'elles savent qu'elles ont besoin de donner parce qu'elles ne sont pas suffisamment nombreuses et pas suffisamment appuyées. C'est difficile de travailler dans des circonstances comme celle-là, où on n'est pas satisfait du travail que l'on fait, sachant et voulant le faire avec toute l'intensité, toute la personne que l'on est. Et on sait que non seulement on n'est pas bien quand on fait ce travail, mais que les soins que l'on réussit à donner aux patients ne sont pas toujours à la hauteur de ce dont ils ont besoin. Alors, il y a des effets mentaux, évidemment, sur la santé mentale des travailleurs de la santé, des infirmières qui sont fatiguées, non bien qui quittent en grand nombre, ou encore qui prennent des congés de maladie, ou qui ont de la difficulté à se projeter dans le futur. Vous savez, dans certaines provinces au Canada, il y a une infirmière sur 2 qui prévoit ou qui pense quitter la profession au cours de la prochaine année. On ne peut pas, évidemment, envisager un tel scénario. Mais il faut écouter ce que les infirmières et les autres experts, les professionnels de la santé nous disent, et être à l'écoute, ça veut aussi vous dire travailler pour eux et pour elles. La bonne nouvelle, c'est qu'on le fait très bien avec les provinces et les territoires depuis déjà le début de la pandémie, et on va continuer à le faire au cours des prochains mois.
My next question is for Minister Gordon. Sorry. Thank you. So Since this year, you have been announcing different financing for the long-term home care. I have heard a lot from the field. People are still waiting for concrete actions. What actions are being taken right now?
Sorry, can you clarify? You said you've been hearing a lot from who?
Outside different groups and everyone from either from the nurses or from other people who need care. So any concrete action, because many announcements have been done, but we're still waiting for any concrete action.
Oh, thank you for that question. One of the concrete actions our government has taken is the establishment of the Seniors and Long-Term Care Ministry with a dedicated minister, Minister Scott Johnson, who's been working very closely with his department and his team to address the 17 recommendations that came forward from the Stevenson Review. And as you know, our government is committed to addressing all 17 of those recommendations, so that's a concrete example. Concrete example is also our government's commitment to establishing a very comprehensive and diverse and fulsome senior strategy. And I've been pleased to join Minister Johnson for some of the announcements that we've made regarding that, in terms of ensuring that more healthcare aides are trained. We've talked already about uncertified healthcare aides that we currently have working in our system, and our government support of funding and training and education to ensure those individuals can become certified and remain in our healthcare system. And we've made announcements as well about additional funding for infection prevention and control, for nursing, and we'll continue to make those announcements in the upcoming months that are just around the corner.
One last question, sorry. The $35 million that is being announced today, what is it going to be used for, and how is it going to be divided among?
So those funds have flowed to the departments and is being used to ensure additional infection and prevention control. I mentioned some of them in my opening remarks. More housekeeping staff, ensuring that healthcare aides join the system, nurses, management. And so those funds have already gone to work in the system, in addition to additional funds that have been provided through the government during this COVID pandemic. So of course, as you know, that long-term care, as Roslyn mentioned, has been quite impacted over the last couple of years, and so that is why our government has come alongside the long-term care and seniors sector to provide additional funding for costs beyond their budgets. And so those monies has already gone to work in the system, and we thank the federal government for their contribution.
Hello, my name is Danielle with the Winnipeg Free Press. Minister Gordon, yes, why hasn't your government initiated a license review at Oakview Place, and will you commit to doing one?
So that's a lead-in question that is not entirely accurate. So our government is looking at all the measures that can be made available to myself to look at the license at that particular facility. So that is under consideration at this time.
Will your government commit to doing a license review at Oakview Place?
That is on the table at this time, on my desk.
Also, just on Pharmacists Manitoba has asked for the cost of COVID-19 rapid tests to be reimbursed to the tune of about $177,000. Is that something that your government will kick in for?
So that is, just so I'm absolutely clear on what that is that for the tests that they ordered and were not able to sell to the public because we were providing free tests? Yeah, so that is under consideration at this time. Thank you.
Hi, Morgan Majeski with City News. Minister Gordon, thank you so much for the time today. You know, we have the federal health minister here. We are still sending folks out of the province, out of the country for surgeries. an important agreement made today, announced today, but what's being done to make sure that the federal government is addressing and working with the province to keep those surgeries and to make sure people could get their surgeries here at home? Is the federal government doing enough to help Manitobans and the Manitoba government keep those surgeries right here in Manitoba?
Mr. Duclos.
You pointed to the right thing, which is all about healthcare workers. We have a healthcare worker shortage and a healthcare worker crisis across the entire country. And that's why Minister Gordon and I and all provincial health ministers have been working over the last few months. Even we had another meeting just a few days ago in addressing how the federal government can support the efforts of provinces and territories in addressing the crisis of healthcare workers. So roughly speaking, what we're doing is seeing how provinces and territories can be supported in retaining those healthcare professionals, including nurses, that are already there. Now, once they leave, it's sometimes very hard to bring them back. How do we look at the conditions that they need? They don't need to stay, but to look forward to staying and to being promoted and to proceeding and flourishing through their career. Second, recruiting, obviously, and that obviously involves training new nurses. There's a lot of potential for that to happen in Canada. That also involves how we support new nurses into the integration of the profession through, for instance, internships or support that will address the critical time that occurs when nurses leave their training and enter the workplace. That's where we hear from nursing associations that there is a challenge. Many nurses find it overwhelming and just too difficult to continue their passion and compassion and stay and prosper in the nursing profession. Then recognizing credentials, in particular, internationally educated professionals. How can the federal government work with national organizations, national medical and nursing organizations, to help at the provincial and territorial level speed up and facilitate the recognition of those people that are here with us in Canada, but that can't work in the healthcare system and therefore can't care for others because their credentials are not recognized. The federal government has an ability to help. Related to that, immigration. We know that we need more people from outside Canada to support our healthcare system. And finally, many other pieces of support, which all centered around supporting healthcare workers, like how do we invest in team-based environments? How do we increase access to family health doctors, to primary care? How do we provide the data that nurses and others can use to best serve information, all sorts of other data, best serve their patients? And finally, how can we plan at the national level for the future? Because healthcare workers need to have an idea of how much planning there is, how much looking forward there is for them to be hopeful about the future. Otherwise, they'll be hopeless. They say, no one is thinking of us, no one is looking after us, no one is telling us what our future looks like. And the federal government has an ability, and I would say a responsibility, to do that, because there are obviously externalities when provinces and territories compete with each other, attract nurses from other provinces, including travel nurses. That can be a short-term fix, but it's not a long-term solution for Canada's healthcare system.
A follow-up for Minister Gordon, if I could. Minister Gordon, would you like to see a similar funding commitment from the federal government, $37 million, maybe even more, to help the province keep those surgeries in Manitoba? Would that be welcome in terms of, that level of funding? And has the federal government been receptive to the crisis, frankly, that we're facing here in Manitoba, and when you bring this to their concerns?
Well, what would be welcomed is for the Prime Minister of Canada to sit down with the premiers and negotiate a fair share of the Canada health transfer. So it's currently hovering at around 22%. And as you know, all the premiers across Canada are calling for that to increase, and Manitoba is asking for an increase to 35%, and that amount continues long-term, so it allows us to plan long-term. and to ensure we can stabilize our healthcare system here in the province. So that is what I feel we need to do now, is to have those discussions and provide a fair level of funding to the province of Manitoba.
Another piece which is aligned with what Minister Gordon said. She said that there is obviously a conversation with at other levels, taking into account the fact that the Prime Minister said there would be further investments. But let me take stock of the actual levels of investments. Over COVID-19, $72 billion in addition to the Canada Health Transfer. Today, $1 billion across Canada. In budget 2022, another $3 billion just for long-term care over the next few years. Just a few weeks ago, a $2 billion additional investment to reduce backlogs in surgeries, treatments, and diagnosis. And over the years, in about 4 years from now, the Canada Health Transfer will automatically increase by about 25%. That's a lot of increase. Now, on percentages and dollars, there is a futile debate and a useful fight. The futile debate is about percentages. Because if you look at the numbers, I know it's a conversation of finance ministers, if you look at the numbers, if you look and you do the calculations right, the actual percentage of public health expenditures funded by the federal government is about 35%. We're already there. Now, it's been like that for many years. For that, you need to make the calculations correctly and include the value of the transfers in fiscal transfers, the tax points that specialists point to. So if you do the calculation right, we're already at 35%. But that's a futile debate. The more important debate is the fight, the important fight for workers. And that's why we have such, we all know how important it is to keep working together together provinces, territories, and the federal government, because that's what at the end matters. It's the results for healthcare workers that matter, because when we do that, we get the right results for the patients, including the hundreds of thousands of patients whose diagnostics, treatments, and surgeries have been delayed. But that's a $2 billion additional investment that was announced just a few weeks ago.
Simple request from the health minister to bring that request to the PMO. Will you commit to at least bringing that again to PM Trudeau's attention?
Certainly, and I have these conversations almost daily with the finance minister and the prime minister's office. Everyone is on the same page.
Thank you so much, Minister.
Oh, Minister, this will be for you. I've been asked about the appointment of a national head nursing officer and how the new position will help address the nursing crisis in the country and in Winnipeg.
Kevin speak about Winnipeg, because not only is he more knowledgeable, but a lot more credible than I would be. So I'll turn to you in a moment. But the chief nursing officer is there to represent the voices of nurses across Canada. There are two objectives in doing that. First, for the federal government, and me in particular, to understand really well their role. 400,000 nurses, obviously the biggest share of healthcare workers across Canada, and for me then to be able to speak appropriately and to work appropriately with my colleagues, health ministers across Canada, who are there also with the same objective of supporting them. So for me to have the right input and to hear the right voice, I need Dr. Chapman. So we're all very pleased that she accepted that difficult role and look forward to working with her. And then turning to Winnipeg, Kevin.
Thank you. You know, if I may, just to provide a comment in the sense that you take a look at it, and what we're really talking about is a stronger voice from a significant stakeholder dealing with the healthcare issues. Here, the focus is on long-term care, getting that better understanding, getting it highlighted from the stakeholders, in particular our nursing profession, which is, you know, tens of thousands of nurses coast to coast to coast. I think it's a valuable input that will lead to good, solid policy recommendations and advocacy.
Merci beaucoup. J'ai une collègue de Radio-Canada qui est occupée, donc on va passer aux questions plutôt en ligne. We will go to questions who are on Zoom. So Charlene, is there any questions from journalists who are joining us via Zoom? If so, over to you.
Yes, thank you. Alors, nous allons maintenant prendre des questions des journalistes sur le Zoom. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. Et sauf si je l'ai dit, veuillez identifier votre nom et votre média avant de poser votre question. We'll now proceed to questions from journalists online with Zoom. If you're a reporter and wish to ask a question, please use the hand raising function. We ask that you limit yourself to one question and one follow-up. And unless I've stated it, please indicate your name and your media outlet before posing your question. So first up, we have Karen McKinley from the Brandon Sun.
Good morning, everybody. Yes, this is Karen with the Brandon Sun. Just getting back to the $2 billion for the surgical backlog and yesterday's announcement about the hip and knee replacement surgeries. And just taking a look, a lot of these places that are on the list are private clinics. And just I wanted to know a couple things. If there's already a number of how many people are going to these clinics, and also just want to know where is the funding coming to help pay for transport to these areas?
I will have my press secretary get back to you with the numbers. I think that information is readily available on the Diagnostic and Surgical Recovery Task Force website. It was also in yesterday's news release. As you know, our government has committed $110 million to addressing the surgical and diagnostic backlog, and the funds to ensure individuals who desire to take advantage of this option can do so without fear or concern about costs falls under that funding.
Okay, thank you. And considering, has the federal government and the provincial government been talking between themselves about how to best invest their share of the $2 billion for this surgical backlog to bring more surgeries back home to Manitoba?
So as Minister Duclos mentioned, federal and provincial and territorial health ministers meet on a regular basis. Our most recent meeting was yesterday, and we discussed a pan-Canadian action plan on resources. You know, we have a global nursing shortage, and we have shortages in other areas of healthcare as well. And so we are talking about what the needs are. It's certainly not a cookie-cutter approach. What may be needed in Alberta is not what we need here in Manitoba. So we're talking about what is unique to each province. And we're also talking about what the needs are in terms of addressing our backlogs for surgeries and diagnostics. And again, we always appreciate funding from the federal government, but what we need is to be able to do long-term planning, and long-term planning is possible when the Canada Health Transfer meets the needs of Manitoba. So what we want to be able to do is to see the premiers sit down with the Prime Minister of Canada and have those discussions, and we will continue as a province to advocate for that to be done.
Next, we have Teresa Wright.
Hi there, I'm Teresa Wright from Global News. I'm wondering, my question is for Minister Duclos. Due to the health worker shortage across Canada, provinces have been increasingly turning to privately delivered health services like virtual care, surgeries in private clinics, agency nurses. How concerned are you about the increased amount of public funds going to private for-profit services?
Thank you. I have a joint responsibility with my colleagues in provinces and territories. My first responsibility is to make sure that the principles of our healthcare system are met by actions across Canada. These 5 principles in the Canada Health Act are quite simple, mostly around accessibility, universality, and equity. And the good news is that we all agree on all of these principles. The second responsibility I have is to acknowledge the jurisdiction and responsibility and the challenges that come with this responsibility of managing the healthcare system. That's the job of my friends and colleagues, health ministers across the country, and I have confidence that they will do whatever they need to do to make those principles met with real actions. Now, as I say that, we are working around a triple R rule. Triple R for respect, responsibility, and resolve. So respect for jurisdiction, as I just mentioned, that's key for a federation to work appropriately. But then a shared responsibility, because we serve the same people with the same dollars, whether they come from provincial or federal coffers, and then focus on results, because that's what matters at the end. So as you know, as we all know, there are ways of using dollars in Canada that at the end may be just detrimental to sustaining a universal, accessible, and equitable healthcare system. But again, the good news is that we're all very mindful of that, and that my colleagues, health ministers across the country, not only are they mindful of those challenges, on those risks of, and the related responsibility of using the dollars appropriately to support equity, efficiency, and sustainability of our public health system, but to continue to work together to make sure that they have all the support from Ottawa that they need.
Did you have a follow-up, Teresa?
Yes, I did. Sorry. Also to Minister Duclos, I understand that you're talking about respecting jurisdiction, but given that we're seeing provinces increasingly relying on privately delivered services, could this affect the province's requests for more funding from the federal government, given that more of that money is not going to a universal public system?
And that's exactly the reason for which we're focusing on results. How exactly those results are achieved at the best possible cost and with the most equitable results, that's part of a conversation. And as I said, we're having them very regularly. Minister Gordon pointed to the fact that we had one just yesterday.
Alors, dernier appel pour des questions sur le Zoom. Last call for questions on the Zoom. No more questions from our end. Back to you, Juliette.
Excellent. Merci, Charlène. I will then pass the mic over to our colleague from Radio-Canada on a specific question for the Minister Duclos. Over to you.
Bonjour, c'est concernant le rachat du pont de Québec. Est-ce que selon vous, la CAQ met en danger les automobilistes de Québec en retardant l'entente comme ça?
Bien, tout d'abord, pour ceux qui nous écoutent, de Québec, parce qu'on comprend que c'est un enjeu qui n'est peut-être pas hyper présent à Winnipeg, soyons très clairs. Une bonne nouvelle, une nouvelle préoccupante. La bonne nouvelle, c'est que le négociateur en chef, Yvon Charest, après beaucoup d'années d'attente et dans son cas plusieurs années de travail, est arrivé à une entente avec le CN. Ça, c'est une magnifique nouvelle pour la région de Québec parce que ça fait depuis 3 décennies à peu près qu'on attend ce résultat. Plusieurs d'entre nous, incluant l'ancien maire Labaume et beaucoup d'autres, n'ont pas cru qu'un jour on aurait une telle entente. Donc ça, c'est la bonne nouvelle. Les nouvelles préoccupantes, c'est que le gouvernement du Québec mettrait un frein à cette entente. Et même ferait en sorte d'en causer l'échec, qui serait une très mauvaise nouvelle, étant donné tous les efforts que beaucoup d'acteurs dans la grande région de Québec ont fait au cours des dernières années pour arriver au résultat d'aujourd'hui. Alors, ce qu'on entend, c'est que une des raisons pour lesquelles ça se ferait, ce serait de donner un argument de plus pour un autre projet, le projet de troisième lien, donc en faisant en sorte que cette entente n'ait pas lieu, on amènerait des arguments additionnels pour aller de l'avant sur le projet du troisième lien. Alors, ce sont 2 projets entièrement différents. Mon propos n'est pas du tout de parler du troisième lien, c'est le projet du gouvernement du Québec. Par contre, mon travail, c'est de continuer avec le leadership de M. Charest pour arriver à une entente définitive qui va répondre non seulement aux attentes des gens de la grande région de Québec, mais aussi aux besoins qu'il y a de restaurer et de pérenniser le pont de Québec. On en a besoin pour de très nombreuses autres décennies. Il faut que tout le monde revienne à la raison et continue à travailler de bonne foi sur cette question importante.
Just one more from Ms. Gordon. Minister Gordon, just one more for you, please. What would you say to Manitobans about the optics of having to send people for hip and knee surgeries from a city of 800,000 people, being Winnipeg, to little tiny places like Kenora, Fort Frances, and Dryden? What is the optics? How would you explain that to the average Winnipegger?
Well, what I want to say to Manitobans is that our government is committed to ensuring that they receive care as soon as possible, that they're not suffering in pain, and that we're taking all the steps necessary to ensure they are provided with options for relief of their pain and suffering. Manitobans have asked our government to respond by creating a suite of options that they can consider. And I want to thank the jurisdictions that have come forward to sign agreements with Manitoba. This is not new. We have been signing agreements through our requests for supply arrangements for some time now. Individuals have been accessing care for several years, Bartley, outside of the province of Manitoba. And as you know, several Manitobans have called for the option to be able to access care in other jurisdictions. Those jurisdictions have a high level of competence. Their doctors, their state-of-the-art facilities, and no standards are being compromised. And I thank all of those jurisdictions that have come forward and all the doctors and nurses that are providing exceptional care, the type of care that Manitobans are accustomed to here at home at those facilities.
Merci beaucoup. Ceci conclut l'annonce d'aujourd'hui. Thank you very much. This is what wraps up today's announcement. Merci à tous. Thank you, everyone. Bonne journée.